It is very important to remember that our patients have rights. They do not have to take a medication if they don't want to, which can be frustrating for us as the nurse, but they can refuse. They can refuse all meds, all procedures, anything that you want to do with them. They have a right to their autonomy. So it's important to always talk to the patient to understand their reasons. If they say they don't want to take something, you can offer patient education or clarify something they're worried about, but we cannot force them to take it. If they persist and they say, no, I do not want this, it's important to, once we've spoken with them, you want to document their refusal, the reason that they give you, and any attempts that you've given to educate them about why this medication is given. The patient has a right to refuse any med, but you still want to notify your charge nurse or their healthcare provider to let them know. But the first thing you want to do is always talk to the patient themselves. Many times in a quiz or a test or ATI or NCLEX, you're going to see a list of interventions. Usually, if one of those interventions is listen to the patient, talk to the patient, discuss the situation with the patient, that's usually the first thing you want to do. You come in to give pain med to a little elderly man and he says, no, I don't want that. We don't want to threaten them or bully them or tell them they'd be better off. You say, well, now why is that, Mr. Jones? The doctor's ordered this med. Can you tell me why you don't want to take it? And many times as they give their reason, you can reassure them or say that, this is what's going on with this particular medication. But if they persist, we cannot make them. Now, special circumstances may require that we get an emergency treatment order. Sometimes you might see a very emergent situation in a psych unit, for instance, or you've got a case involving children. Someone brings a child in, the child's hematocrit and hemoglobin is very low, but the parent is refusing a life-saving blood transfusion. In that case, it needs to go up the chain of command, and the patient's family, or maybe the patient themselves, will ultimately be overruled. But if it's an independent, lucid patient who is capable of making their own decisions, they do have a right to refuse, whether we agree with it or not. Now, the last step is evaluation. And remember, we are always looking for the correct response. Remember from chapter 3 that we are going to see 3 responses when we're looking to evaluate. We are looking for a therapeutic effect from the medication. Does the drug do what it was supposed to do? It's a pain med. Does it relieve pain? It's insulin. Does it lower the patient's blood glucose? It's an antihypertensive. Does it lower the patient's blood pressure? Then we want to see what side and adverse effects from the medication. Side effects, which can be mild and either anywhere from annoying to beneficial, or adverse effects, more serious adverse effects, things that can be very unpleasant or even life-threatening. And remember, that can encourage allergic responses. So the allergic response and the adverse effect can kind of go hand in hand. So if they ask you, 3 things to look for: therapeutic effect, side effects, adverse effects, including allergic response. If the breathing is affected, the patient loses consciousness, you see a widespread rash, the patient complains of itching, they're fidgety, they're short of breath, we want to stop the med, especially if it's IV. We want to call the supervising RN or the healthcare provider, depending on the situation, or both. And somebody needs to remain with the patient, keep them calm, elevate the head of the bed, take some vital signs, and just keep them reassured. On page 9 in your textbook, we see safety tips. So it's very important to read those and refer to those. We see some on page 7, and we see some important ones at the bottom of page 9. Also one on page 8, never leave a drug at the bedside for him or her to take later. An exception to that being an assisted living, where you might prepare the med for the patient and then they take it themselves, but that is hospital protocol. The average hospital patient, nursing home patient, you prepare the med and you make sure that it's given. So, don't let this be you. Make sure you remember all steps of the nursing process and how those steps of the nursing process apply to medication administration. And that is it for this chapter.